This is my presentation. Here's my audience. I have my son, some stuffed animals, and my husband, because I couldn't get a third person. Today I'm going to talk to you about what a national patient identifier is. I'm sure not all of us will go to the same doctor our entire lives, or much less stay within the same organization. So making sure your health information follows you is very important to ensure that you get the proper care from the physician that you are seeing. That's where this idea of a national patient identifier comes from. In this presentation, I'll talk about what exactly health information is, what a national patient identifier is, and also other aspects that relate to and are important to this category of the national patient identifier. So according to AHIMA, national health information is the data related to a person's medical history, including their symptoms, diagnosis, and procedures and outcomes. So anything that goes on within a medical facility where you're being treated is considered your health information. So who keeps a record of that information? Pretty much anywhere you go, any facility you go to, they're going to keep records of the visit and anything that they have found during that time. Therefore, if a person goes to different facilities, you're going to have different records assigned to you at those different facilities. There are 4 main types of patient identification that the medical field uses to identify a person. Those 4 things are name, date of birth, address, and gender. Name can pose a problem because people change their name either by marrying or by choice. Date of birth, there can be multiple people with that same date of birth. Address, people move a lot, so they don't always know which address to be giving when they are being seen. And then gender also nowadays poses a problem because of all of how people identify and the various gender reassignments that go along with that. And unfortunately, there is no uniform way of identifying patients. Patients need to be invested in making sure that they are properly identified so that they can receive the proper care. And also medical staff needs to be educated on proper identification of patients and the questions that need to be asked. No yes, no questions. Have them actually answer with what their name is or what their date of birth is. So a national patient identifier is a unique number that is assigned to a person, and it stays with them from birth to death. And all of their medical information, wherever they go to see physicians, is all contained within that number. So all their medical information in one place. And the HIPAA Act of '96 actually has some language within it saying that this needs to happen, but due to privacy concerns, they have banned it, and they've actually denied funding to go ahead with it for anything regarding a national patient identifier. Why is it needed? It's needed because properly identifying a patient is crucial. That ensures proper patient care, and it's said that 63% of misidentification occurs at registration. 2 main problems resulting from misidentification is duplicate records and overlays. Duplicate records is when one person is associated with multiple different records, and an overlay is where someone's medical information is actually overwritten onto someone else's. Duplicate records can occur at a rate of 8 to 12%, and this can happen with same name and same birthday. In this illustration, it is specifically saying, like, this woman named Maria Garcia goes to a facility where there are 2,488 people named Maria Garcia. So you have to go a step further. Well, so they ask her birthday. There's 231 people with the same name and the same birthday. So as you can see, it makes proper identification a little difficult. These are the top 5 causes of patient misidentification. And the top 2 are incorrect identification at registration and the time pressure that medical staff feels when treating patients. Costs with duplicate records, and duplicate records also mean you can also have duplicate testing, and this is more for duplicate tests is almost $2,000 per inpatient visit and $800 per ER visit. And it often takes a sentinel event to realize you have a problem with patient misidentification. And according to the Joint Commission, a sentinel event is a patient safety event that can result in death, permanent harm, or severe temporary harm. There is costs associated with this. $3.9 to $9.2 billion is what is estimated to get this program implemented. And there's a wide variety of different costs associated, but architecture needs to ensure nationwide connectivity, startup costs, and then you also need to enhance security and safety measures for that. And Congress has partially lifted the ban now from the HIPAA Act, allowing government to work with different industry professionals on the technical assistance needed for this. Several different petitions and things in support of it. You can see there's advocacy campaigns, crowdsourcing initiatives, and Experian is getting in on it too, and it helps that they have had government programs that they've done before, so that allows them to handle the personal health information. Advantages and disadvantages. We had talked about an advantage being that all your medical history is in one place that ensures proper care and that you're receiving the care you need. Reducing duplicate test costs. So it'll reduce costs because you're not going to have the same test repeated over and over. And the people's hesitancy to use their social security number because of credit and insurance fraud. And we don't tend to write those down, so we give them verbally, and then you can have problems with it being transposed wrong into the system, which would lead to misidentification problems. And of course, the disadvantages are the cost, and then you have increased risks of hacking and fraud. So on that note, it shall be interesting to see where this leads in the future, and if we can figure out a way to reduce the cost to implement something like this, or if it's just not feasible and the cost is too much to implement this. And then my audience is still here. There they are. All right, thank you.